We've already discovered, just since I've been here, and even before, since the inauguration, tens of billions of dollars that is of fraud easily taken back. We just stopped recently a couple $100 million going out the door that would have actually been taken by folks, and who knows where they are taking the money when they get it.
America, a 79-year-old CEO just got hit with 15 years in federal prison for running a $1 billion Medicare scam that targeted your grandma. Gary Cox built an internet platform that generated fake doctor's orders, billed Medicare for medical equipment seniors never needed, and pocketed $360 million before the feds finally caught him. But here's the part that's gonna piss you off. He used offshore call centers to scare elderly Americans into giving up their Medicare numbers, paid doctors to sign orders for patients they never even examined, and deliberately hid the word telemedicine from paperwork because he knew it would trigger audits.
We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs.
What is up, guys? Tyson DeLaCruz here. Thank you so much for rocking with me. This is what I keep telling you. When Democrats talk about expanding healthcare access, what they really mean is creating more opportunities for criminals to steal from taxpayers. Let me show you how this scam worked and why it actually matters. Gary Cox wasn't some small-time side hustler. This man built an entire platform called DMERx, Power Mobility Doctor RX, that functions like an assembly line for Medicare fraud. Think about that. He created a system specifically designed to generate fake medical orders. Here's how it works. Cox connected medical equipment suppliers and pharmacies with telemedicine companies. The suppliers would pay kickbacks for signed doctor's orders. Cox platform would generate those orders. Then telemedicine doctors who never examined patients would sign them in exchange for payment.
The largest Department of Justice healthcare fraud takedown in history. The fact that it's even possible that you could have $15 billion to play in this endeavor is shameful. But that's how we're being attacked now, and it's not done by small-time operators. As you're hearing about and you will read about, these are organized syndicates who are designing to hurt America.
Earlier this year, Dr. Oz broke down how half of the people on Obamacare don't even use their insurance, and the taxpayers are getting hit twice. That is exactly what Cox was doing, billing Medicare for equipment people didn't need, didn't want, and in many cases never even received. The emails prosecutors presented are absolutely wild. Cox and his crew were literally negotiating prices per doctor order like they were selling cars. We need to be at $150 instead of $125. We made this price up before we took any calls. My friends, that is not healthcare. That is a criminal enterprise with a medical license. Now let me show you the most disgusting part of this particular operation. Cox and his team went after hundreds of thousands of elderly Medicare patients using every scam tactic in the book. Junk mail promising free medical equipment, TV commercials making it sound like Medicare was offering new benefits, and offshore call centers. Offshore call centers calling American seniors to scare them to provide their personal information.
This is an urgent message for all patients on Medicare regarding your eligibility for top-of-the-line braces to alleviate your pain and increase mobility. This is your final notice. If you do not act soon, Medicare will label you ineligible for coverage.
Listen to this garbage. This is your final notice. You'll be labeled ineligible for coverage. They're literally terrorizing elderly Americans into giving up their Medicaid number. Obviously, these aren't medical professionals, you guys. These are scammers reading scripts designed to create panic. You know what really gets me? These are the same people that Democrats claim to care about. We need to protect our seniors. We need to expand Medicare. Meanwhile, they created a system so bloated, so poorly monitored that criminals can steal billions and billions of dollars before anybody even notices. Once they had your grandmother's Medicare number, the platform would auto-generate a doctor's order claiming a physician had examined her, but the examination obviously never happened. In most cases, there was either a quick phone call or no contact at all.
These are not isolated instances of poor judgment. These are calculated schemes designed to exploit Americans while enriching the very people who were duty-bound to help them heal.
The DOJ said these aren't mistakes. These are calculated schemes to exploit vulnerable Americans. And that's the truth. Cox wasn't confused about the rules. He was deliberately breaking them because he knew the system was too broken to catch him. Here's where it gets really wild. The doctor's orders claimed physical examinations were performed, medical tests, clinical evaluations, all documented in official medical records. But obviously those tests never happened. Medicare was billed over $1,200 for orders claiming examinations that were completely fiction. Doctors were paid to be human rubber stamps, signing the order, collecting the check, and moving on to the next scam. The DOJ went after pill mill operators who exist solely to distribute drugs for profit. That's basically what these telemedicine doctors were, pill mills for medical equipment. They weren't providing actual care. They were providing signatures in exchange for kickbacks. Medical equipment suppliers paid Cox's platform for orders. Cox's platform paid telemedicine companies. Telemedicine companies paid doctors, and Medicare, meaning you, the taxpayer, paid for it all. Over $1 billion in fraudulent billing, $360 million actually collected before they actually got caught. What makes this case absolutely damning is the evidence showing Cox knew he was committing fraud and actively tried to hide it. Prosecutors presented emails where Cox's team talked about eliminating dangerous words for medical orders, words like telemedicine or phone conversations that might trigger Medicare audits. One co-conspirator literally wrote, "It will raise a red flag for CMS in an audit." That is not a compliance issue. That's not a misunderstanding. That is conscious guilt. They knew what they were doing was illegal, and they were engineering a system to avoid detection.
The $31 million that I know of last week is a great example of this. We stopped the money by using new technology, by modernizing how Medicare and Medicaid works from even leaving the building because we knew something was fishy about these bills. And these aren't just small little mistakes. These are organized criminal efforts to hurt our country.
But Cox's scheme ran for years, billing over $1 billion before anyone got caught. That's how broken the system was under the previous administration. They created fake invoices labeled marketing and advertising when they were actually paying for doctor's orders. They varied the medical language and electronic records so orders wouldn't look identical. This was a sophisticated criminal operation disguised as a healthcare company. Let me put this in perspective. Medical equipment suppliers using Cox's fraudulent orders billed Medicare and other insurers more than $1 billion. They actually collected $360 million before federal investigators shut it down. That's $360 million stolen from Medicare. Money that was supposed to help elderly and disabled Americans get legitimate medical care. Instead, it went to Cox, his co-conspirators, corrupt doctors, and suppliers who were all in on the scam.
The feds say offshore call centers contact Medicare patients and get personal info from many of them. A doctor then signs a prescription for a brace, sometimes after a brief phone consultation. A medical equipment company fulfills the order and bills Medicare, sending a kickback to the original conspirators.
Just like every other program Democrats run, the money goes to connected insiders who claim they're providing services. But that's not where the money goes. It goes to kickbacks, bribes, and personal enrichment, while the people who actually needed help got nothing.
If we don't make some of the changes by reducing fraud and waste and abuse now, we're putting those young people, those old people, and the people in the middle who are in the shadows in trouble.
All right.
Dr. Oz made it crystal clear. You can't take federal money meant for one purpose and use it for something else. That's exactly what Cox and his co-conspirators did. They took Medicare money meant for legitimate medical equipment and turned it into their own personal ATM. Gary Cox got sentenced to 15 years in federal prison and ordered to pay $452 million in restitution. At 79 years old, that's a life sentence. And the U.S. attorney made it clear why they asked for maximum punishment. Cox and his co-conspirators orchestrated one of the largest healthcare frauds in our nation. A significant sentence is required to show the seriousness of these particular crimes.
Under our watch, criminals will not be allowed to enrich themselves with dollars meant to improve the health of Americans.
And this $1 billion case, it's just scratching the surface. We see what's going on in Minnesota. We see what's going on in other places. The DOJ's healthcare fraud strike force has charged more than 5,800 defendants since 2007 who billed federal programs more than, get this, $30 billion. America, here's what nobody wants to admit. Democrats didn't create Medicare to help people. They created it to create dependency. And every time they quote unquote expand these programs, they're really just creating more opportunities for criminals to steal. Cox exploited a system that was designed to be exploited. Bloated bureaucracy, minimal oversight, automatic payments, and zero accountability. Because when you create massive government programs with trillions and trillions of dollars flowing through them like water, you create a perfect environment for fraud. The Trump administration is finally using technology and data analytics to catch these schemes before the money leaves the building. But for every case they prosecute, how many more are still running right now? How many more platforms like DMERx are generating fake orders while we're sitting here? This, my friends, is partially some of the reason I don't trust government healthcare. Not because I don't want people to have medical care, but because I've seen what happens when you put bureaucrats in charge of billions and billions of dollars with no accountability. You get fraud, you get waste, and criminals who get rich while taxpayers get robbed. Let me know what you think about this. Drop it down in the comment section down below. Smash the like button if you kindly would. Share, subscribe, and as always, guys, I'll catch you on the next one.